Our topic is Clostridium Botulinum. Botulism. It is a serious illness caused by the bacteria called Clostridium botulinum. The bacteria produce a toxin that can attack your body's nervous system. This attack can cause the weakness and paralysis that affects the muscle that help you move and breathe. If left untreated, botulism can be fatal. Botulism poisoning is rare, but because it can cause the death. You should call your emergency number or go to your nearest emergency room if you or your child develop the botulism symptoms. The symptoms may include the drooping eyelid with other signs affecting the muscles of your face, eyes and throat. It can eventually affect the muscles related to breathing. What are all the different types of botulism? There are several different types of botulism. The most common kinds include foodborne, infant, wound botulism and iatrogenic, that is an adult intestinal toxemia botulism, and there are the rare forms of the botulism also available. Let us see about the foodborne. They can happen when you eat food contaminated with the Clostridium botulinum spores. When food is stored improperly, bacteria can grow. As the bacteria grow, they release the toxins into your food. Foodborne botulism commonly occurs when homemade canned foods are improperly preserved or stored. Though rare, improperly canned store-bought food can also cause the botulism. Other sources of the foodborne botulism include the oils infused with herbs, potatoes baked in the aluminum foil, canned cheese sauces, bottled garlic, canned tomatoes, carrot juice, and foods that kept warm or left unrefrigerated for too long. Infant botulism. Botulism in the babies can occur when the Clostridium botulinum spores are ingested. When the spores reach your baby's intestines, they grow and release the toxin. The source of the spore isn't always known, but they are commonly found in the soil and dust. When the soil and the dust become airborne, your baby may breathe them in. The spores may also be present in honey. Ingesting the botulinum spores doesn't cause the botulinum in the healthy older children and adults, but for reasons unknown, the toxin is released in the infants younger than the 12 months old. This is why experts advise that babies shouldn't eat the honey until they are at least 1 year old. Wound botulism, they can develop when the Clostridium botulinum spores get into the wound. When the spores get into the wound, they can grow and release the toxins into your bloodstream. The most often occurs in the people who use the needles to inject the drugs into their veins. In rare cases, it can also develop after the surgery or the serious injury. Iatrogenic botulism. This can occur when you have too much of botulinum toxin injected. Botox. They are used as a purified and heavily diluted form of the Clostridium botulinum. You may receive botulinum toxin treatment for the cosmetic reasons such as wrinkles, or you may receive them for the medical reasons such as a migraine headache. Botox botulism is rare, but you should only get the botulinum toxin injections from a licensed medical professional. They will know the safest and the correct amount to give you. Adult intestinal toxemia botulism. It is also known as the adult intestinal colonization. It is a very rare kind of a botulism that can happen when the Clostridium botulinum spores get into your intestine. The spores grow and produce the toxin the same way they do in infants. If you have a serious health condition that affects your digestive system, you may be more likely to develop this form of botulism. How common is botulism? This is a rare one. In 2018, 242 confirmed botulism cases were reported to the Centers for Disease Control and Prevention. Most of the cases involved the infant botulism. What are the signs and symptoms of botulism? They are ranging from mild to severe. They may develop anywhere 3 to 30 days after the exposure to the Clostridium botulinum spores. Symptoms like dropping eyelids, that is ptosis, loss of facial expression, drooling, weakened cry, slow or poor feeding, reduced gag reflex, constipation, weakness or floppiness, and difficulty in breathing. They also feel nausea and vomiting, weakness or the paralysis of your arms and legs, difficulty in breathing, difficulty in swallowing like dysphagia, slurred speech, serostoma, that is dry mouth, and blurred out the double vision. What causes the botulism? A bacteria called Clostridium Botulinum causes the botulism. Sometimes Clostridium Butyridium or Clostridium variety bacteria cause the botulism. The spores of the Clostridium botulinum bacteria are commonly found in the soil, but only rarely make you sick. But under the certain conditions, the spores can develop and grow. These mature bacteria then release the toxin. When the toxins are released, they quickly spread into your bloodstream and attach to your nerves. Botulism develops when these nerves no longer work. The condition that allow the spores to develop and grow include low oxygen or the lack of oxygen, low acidity, sugar or salt, cooking at the temperature that are too low, like even boiling, may not destroy the spores, certain amounts of the water, and storage temperature that are too warm. How is botulism diagnosed? To diagnose the botulism, your healthcare provider will perform a physical examination. They will ask you about your symptoms and check for weak or paralyzed muscle. They can resemble the symptoms of other conditions including the stroke, meningitis, and Guillain-Barré syndrome. So, your healthcare provider may need to do further testing to confirm a diagnosis of the botulism. The other tests that will be done to diagnose the botulism to confirm, like they show the toxin, whether it is present in your blood, stool or vomit. Suspected food samples can also be tested for the toxin. They will take a test like brain scan, spinal fluid exam, nerve and the muscle function test, that is electromyography. The test results can take several days, so your healthcare provider may begin the treatment right away if the botulism is suspected. How is botulism treated? Depending on the cause and the severity of your botulism, your healthcare provider may use a variety of treatment options. In the most common treatment, your healthcare provider will give you a medication called an antitoxin. Antitoxin blocks the toxin's activity in your bloodstream. This prevents the toxin from causing any more damage. But antitoxin can't heal what already been damaged. You may need to stay in the hospital for weeks or months while you heal. If you have a breathing problems, your healthcare provider may replace you for the breathing machine. It is a ventilator. A ventilator is a machine that helps you for the breath. You will be on the ventilator until any paralysis affecting your breathing that goes away. If you have a wound botulism, you may need an operation to surgically remove the contaminated part of your wound. After the operation, you may take the antibiotic to keep the infection from coming back. What are all the complications or the side effects of the botulism? They can paralyze the muscle that help you swallow and breathe. While antitoxins can help in many cases, some people do die of breathing problems and infections. In addition, the health issues that may result from the botulism include extreme tiredness, fatigue, long-term weakness, shortness of breath, dyspnea, aspiration pneumonia and infection, nervous system issues. How can I prevent the botulism? For the foodborne botulism, refrigerate the food within the 2 hours after the cooking. Proper refrigeration prevents the bacteria from producing the spores. Cook the food thoroughly. Avoid the food containers that appear damaged or bulging. This can be the sign of a gas produced by the bacteria. Sterilize the home canned foods in the pressure cooker at 250 degrees Fahrenheit for 30 minutes. Throw away the foul-smelling preserved foods. In case of infant botulism, don't give the honey to babies under the 1 year old. Breastfeed the chest feed your baby to slow the onset of illness if the botulism develops. Wound botulism, don't abuse injectable drugs. Seek a medical treatment for the wound with the signs of infection including the redness, tenderness, swelling or pus. Clean the wound contaminated by the dirt and the soil thoroughly. Iatrogenic botulism, only get the Botox injection from the licensed medical professionals. Conclusion. Botulism can be fatal if left untreated, but most people who receive the prompt diagnosis and the treatment can make a full recovery from the illness. They return to the normal functioning through their life. Botulism is a serious illness that attacks your body's nervous system, causing the weakness and muscle paralysis. This is poisoning, but it is a rare one. But if left untreated, it can be a fatal one. Thank you.